Today, we're going to talk to you about 20 years of pregnancy knowledge summarized for you in less than 20 minutes. So if you're trying to get pregnant, here's where to start. Did you know that it takes an average of 17 years for research to be implemented into practice? In less than 20 minutes, we're going to cover understanding your hormones, cycle, and ovulation, testing, so how to test for when you're ovulating, but also what blood tests that you should get or conditions to rule out that might be preventing you from being able to get pregnant. We're also going to talk about prenatals. Should you be taking one and why? What should you be looking for in there? And finally, what can you do from a lifestyle perspective to help to support your fertility, your ability to get pregnant? Okay, so let's dive in. The very first and most important thing you need to know to be able to get pregnant is when you are ovulating. You can only get pregnant once a month. When you ovulate, that egg needs to be fertilized within 24 hours after its ovulation. That is the only time each month that it is viable to be fertilized, that we can create a baby. So sperm needs to be introduced during those 24 hours, or it needs to be waiting there in order to fertilize that egg when it is ovulated. And this is possible because sperm can survive for up to 3 to 5 days. So if it was introduced in that 3 to 5 day window before ovulation, right, it is still living and viable when that egg is ovulated. It can still fertilize that egg. So therefore, we need to know when ovulation is coming, and we need to make sure that we are confirming that ovulation happened so that we can know our body better, our cycle better, to make sure that this great hormone cascade is happening and things are in balance, because this is what is going to be helping us to be able to get pregnant. So let's talk about that. Let's understand that hormone cascade to help you better understand your own hormones and your own cycle so that you can start to prepare and get your body on track for when you want to get pregnant. In order to understand ovulation and its timing, I like you to understand your hormones in general. So many people tell me this is what they wish that they knew about their body all along, or they wish that they were taught or learned in school. Funny enough, most of us actually were taught this in school, but it's funny how when we hear things differently or at the right time, when they're so much more relevant to us, that it really sticks, right? So you might have heard this again in biology class, but here today, you're going to understand how much it relates to you and what's going on in your body right now. So during the first half of our cycle, so first off, when we're counting our cycle, counting the days of our cycle, cycle day 1 is the first day that you start bleeding. Okay, not the last day, not the day that it's done, the very first day that you start to bleed. Cycle day 1. So for these first kind of 2-ish weeks on average of our cycle, right, we have a hormone called follicle stimulating hormone, or FSH, okay, that is stimulating your ovaries, right? It's stimulating the follicles in your ovaries to start to grow and develop. And it is this growing, developing follicle that is producing estrogen. Okay, estrogen does a lot of different things in our body, but its role in our uterus is to help to thicken the uterine lining. Okay, because if we are going to fertilize that egg this month, we need a good, nice, thick, nutrient-dense place for that egg to be able to implant to support the baby. So as that egg is growing and developing, we have more and more estrogen. Estrogen is really dominating this first half of our cycle. Then around halfway through that cycle, we have a peak, we have a spike in a hormone called LH, or luteinizing hormone. Okay? This is a signal to our body to ovulate. So when we see this peak in LH, typically it means we are going to ovulate in the next 24 to 48 hours. Okay? And I want to be clear, LH is simply a signal to stimulate your body to ovulate. It does not mean that it is confirming ovulation or that ovulation has actually happened. Okay, we're going to talk about that in a little bit. What it simply means is that follicle, right, is mature, it's ready to be ovulated. We have that peak in LH, stimulates our body to ovulate, to release that egg from our ovary, right, and it comes then into our fallopian tubes. It is in this next 24 hours that that fertilized egg, right, has been ovulated, it's viable, right? It's able to be fertilized by sperm. So this is where the sperm needs to be introduced within that 24 hours, or it needs to be already waiting there in order to fertilize that egg. And this happens in the fallopian tube. So that egg and the sperm meet in the fallopian tube when we're timing around ovulation in order to get pregnant. This is where we need to either see that LH peak, then we can be trying every other day, every third day. Those are all great options so that we have healthy, viable sperm waiting to fertilize that egg, because that can all be there, can be happening before we ovulate. But if we try too late in the month, if ovulation has already happened, if it happened earlier that month, if it's past that 24-hour viability window, we cannot get pregnant that month. We're going to have to wait till next month. Okay, so key thing to note and remember. Now, this typically happens around halfway through our cycle on average, right? But this is where we like to use LH strips to predict when ovulation is actually coming for you, understanding your own body. And when we said LH is simply a signal to stimulate our body to ovulate, it doesn't actually confirm. What we can do to help to confirm ovulation is by tracking basal body temperature. So basal body temperature doesn't tend to tell us when ovulation is coming, but it can confirm that it happened. So we'll dive into that a little bit more later to help you understand. But we typically see that timing. And then once that ovulation has happened, what is left in our ovary? We can picture it like the eggshell, okay? But it's called the corpus luteum. Big word, doesn't matter. What does matter about it is that it is producing progesterone. So progesterone really dominates the second half of our cycle, okay? Our luteal phase. This first half was the follicular phase as that follicle was developing. After ovulation, we move into our luteal phase, okay? And this is where progesterone really dominates. So again, progesterone does a lot of different things in our body, but what it does in our uterus is it holds our uterine lining in place. So for these next 2 weeks, it is holding our uterine lining in place because as this egg and sperm, if they have been fertilized together, they are developing, okay? This zygote is being created, all this great cell division is happening. And from that time of conception, it's typically going to take about 6 to 10 days in order until our egg reaches our uterus, right? And it's going to potentially implant. Okay. So that estrogen was developing that nice thick uterine lining for us that first half of the cycle. And now progesterone, the second half of our cycle, is holding it in place so that if and when that fertilized egg gets there, it's going to have a great spot in order to implant in there. Okay, so if we are pregnant, progesterone stays high and in fact continues to increase. Okay, so our uterine lining is being held in place, we don't get our period, right? But if our egg has not been fertilized that month, which is most months of our life, right, that corpus luteum starts to die, progesterone starts to decrease, there's nothing holding our uterine lining in place anymore, we start to shed our uterine lining, we get our period. Another key thing that progesterone does in our body is it raises our body temperature, okay? Ever so slightly, it's not dramatic, but that's important because when we see that elevation in our body temperature, it means that it is confirming that ovulation has happened, right? That ovulation has happened. We have the corpus luteum producing progesterone in our ovary. And so one of the ways that we can confirm ovulation is through tracking that basal body temperature. So when we track basal body temperature, we're going to use a thermometer that has 2 decimal places on it because, again, that increase in temperature is slight. So that's the amount of detail that we need, right? So after that, dot, we have 2 numbers and we're going to track those in there. Again, throw them into an app. Don't try to do it yourself. See it graphed out. And it's really, really neat, the amount of information that it can give us about our body, our hormones, and help us to confirm that ovulation and when that likely happened for us, right? So when we see that elevation in body temperature, that typically means that ovulation has happened. Okay, there is progesterone, there's enough progesterone, right, to see that there, which is great. So I love pairing basal body temperature with using LH strips to start to understand our body. And then of course, especially when we're trying, LH strips, they are something that you will buy. Okay, they are something that you pee on or you dip in urine, and they are tracking, they're measuring the amount of that hormone LH in your urine. Okay, so when we use these as strips. Again, we can put them in an app to help compare them, because it's not simply going to tell us a yes or a no. Okay? They show up as darkness on a strip. Okay, so we can start to see it lightly and then get darker and darker, seeing it peak, and then we can actually see that come back down as well. And when we're taking these, we can typically take just one a day, doing them at the same time every day. So, when we first wake up on that first urination, it's a good time to take it because it's that good concentration, most concentrated urine there. Okay? And then we can see those. We can see what day they're peaking and happening, what variation we might see from month to month, right? We can see when it's going to be a good time to try this month. When we start to see that getting dark, we don't even need to wait for the peak. That's when we can start trying. Okay, even if it's every other day, every third day, sperm can live inside of you for up to 3 to 5 days. So if we are having intercourse even every third day, right, that still gives us a great chance in order to have healthy sperm present when we ovulate. So when we start to see that getting dark, definitely when we see that peak day, those are great times to try and do that. Again, we can then combine that with basal body temperature tracking. So we can see, our temperature is a little bit lower, then we see it go higher when we take this basal body temperature. We need to take it very first thing in the morning, okay, before we've even gotten out of bed. We have barely even opened our eyes yet, right? Under our tongue can work. You can also use wearable trackers like the Oura Ring, for example. Measures your basal body temperature every morning. You can connect it to an app, Natural Cycles, that will map out all of these things for you, and you can add your LH strips in there too. So whether you are actively trying to get pregnant right now or just preparing for fertility, tracking your ovulation, starting to see and understand when this happens in your body is such a key thing, because again, the number one thing we need to do to get pregnant is ovulate. We need to know when that is happening. We need to try on that time. So if you're going to take one thing away from that video, that is the key thing to know. Now, we've talked about ovulation and ways we can test or track your ovulation. Let's talk about what other testing can be done to help you prepare for pregnancy. Make sure that there are no underlying issues or things that need to be addressed. If we can address these things in advance, they can help us get pregnant faster. So we always want to rule out basic nutrient deficiencies. So making sure you have good levels of iron, B12, vitamin D. All of these things have been associated with infertility or unexplained infertility. We also want to be testing our thyroid. Healthy thyroid levels are so essential for having healthy balance of female hormones, but also ability to maintain that pregnancy. Okay. Beyond this, other options for testing that we can look at, we can test for AMH. AMH can be an indicator of egg quality, of egg reserve. Okay, this is something AMH typically decreases as we get older, as we have lower ovarian reserve. It doesn't mean that it is a be-all, end-all, with this information that we get from it, but it can be a good indicator to help us understand if we really do need to focus on egg quality supports, for example. Okay, we can also test our hormone levels, so checking estrogen and progesterone levels, making sure that our progesterone levels, right, are high enough in order to maintain that pregnancy. They can also be an indicator of if we are ovulating. That can be really helpful. If we see hormonal imbalances, sometimes this can also help to lead us and indicate that we might have endometriosis or PCOS. These are all conditions that can make it more challenging for us to get pregnant. Not that we cannot get pregnant with them. It's just good information for us to know so that we are getting the treatment, the care that we need to support our body better so that we can get pregnant faster when we do want to do that. Other hormones that we can make sure we're looking at to make sure things are in good balance for us would be our androgens. Okay, so testosterone and DHEA can all be indicators. Sometimes those are out of balance or higher when we have PCOS. They can also, again, cause hormonal imbalances for us there. They can actually really prevent ovulation, right? So checking in that those are in good balance is important. Checking our cortisol levels can sometimes be important because when these are out of whack, our female hormone can be out of whack. Cortisol is our big stress hormone. So checking in on that. If we are really struggling as well, sometimes checking prolactin can be important. Prolactin can be a signal to our body that we are already pregnant, essentially. So when we have high prolactin, that again can inhibit our body's ability to ovulate and then be able to get pregnant. So we've talked about your hormones and cycle, ovulation, right? Testing, all good things to understand about your body, right? And rule out that might be issues with being able to get pregnant. But now let's talk about what you can do to help to prepare your body for pregnancy. So number one that you probably hear is take a prenatal, right? But it can be a great place to start and is in fact essential, right? For a few different reasons. So the number one thing that we need in a prenatal is folate. Okay, folate in a minimum of 400 micrograms a day has been shown to help to prevent neural tube defects. Okay? Neural tube defects can be things like spina bifida, other neural and spinal cord conditions, but why we care so much about it and taking it in advance, okay, of trying to get pregnant is that neural tube, it's a part, so it has to do with the ability for our neural tube to fold and do this effectively. Okay, and this happens very early on in pregnancy, typically around week 5 of pregnancy, when we are counting our pregnancy weeks. Week 1 actually starts on the first day of your last period. Okay, so really we have those on average 2 weeks before conception even happened that we're considering in your pregnancy weeks, when really you were not pregnant. It's just how we count out those 40 weeks. And so when we say we're 5 weeks pregnant, really, conception would have happened at week 2, right? Implantation might have happened at week 3, maybe even week 4. So we might just be finding out we're pregnant around week 5. And this is already when that neural tube is folding. And we need the folate in advance of that. So that's why it's so important to be taking that in advance of being able to get pregnant. Other great things that we want to make sure we're looking for in a prenatal, again, to prevent those nutrient deficiencies that can be associated with infertility or more challenges of getting pregnant, would be iron, B12, vitamin D. All these things can be super essential. During pregnancy, we're going to need more of them, so it's great to stock up on those stores too, but they can actually sometimes help us to get pregnant. Other key things we want to look for is egg quality supporting ingredients. Okay, so antioxidants can help us with this too. So that could look like things like vitamin E, selenium, zinc that are commonly found in prenatals, but we could even use even more focused ingredients such as CoQ10, L-carnitine, NAC are all good options if these are important focuses for us. Those would be essential if we're having challenges getting pregnant, if we're at a more advanced age, right? Or if we have lower AMH that's been established, or just taking them in pregnancy to help to improve our egg quality, have that best chance of getting pregnant can be a great option as well. If you have any underlying conditions such as PCOS, if you are having hormonal imbalances, just challenges with ovulation, inositol and B12 have shown to be able to help to support ovulation in there as well, help to support our balance of our hormones too. So those can be great choices to look for in there too. Another thing that I like to look for as well is ginger in prenatals. Ginger can be a great anti-inflammatory. It can help with flow and circulation, which can be another thing that's being researched as a potential cause of unexplained infertility. But it can also help with nausea in pregnancy, especially in that first trimester there. So if that's already in our prenatal, it can help to prevent, but also treat nausea during our pregnancy. B6 can help with this nausea as well. B6 is also another great hormone regulator. So looking for that in there, and really a complete B vitamin is really essential to look for too when we're looking at a good quality prenatal. Taking a prenatal is a great way to prepare for pregnancy. And Working with improving your lifestyle factors can be another essential thing, right, to help us to be able to get pregnant. We can take supplements all day long, but it's the lifestyle things that really leave a lasting impact and can help to support so many things and even help to support your prenatal work better for you too, right? So lifestyle factors include diet, exercise, sleep, and stress management. Okay, when we're talking about diet, working on blood sugar balance with our diet can be a really important thing to help us to promote ovulation. We want to make sure we're increasing vegetables, right? Especially having vegetables at the beginning of a meal can actually really help us with our blood sugar balance. That can be a great option. Having protein at every meal, right? Especially after those vegetables can again help with blood sugar balance. And then having healthy carbs, right? Healthy carbs are actually essential in order to be able to produce hormones. And we need to fuel our body with enough calories and consistently with a well-balanced diet in order to signal to our body that we can and are able to support this baby. It's really, really helpful and important, essential in order to help us have healthy hormones, ovulate, right? And our ability to get pregnant. We want to have good healthy fats in there too, that complete balanced diet, always going for more whole foods than processed foods. Simply starting there can be really helpful. Even what can we add to our diet, right? Can I add a vegetable to the start of this? Could that look like some cucumbers, some carrots and hummus, an oil and vinegar salad, right? What can I add to start my meal? Where's my protein coming from, right? And then moving on with those. Next up, we have exercise, moving our body in any way that feels good to us, right? That could look like going for a walk outside, right? Biking, yoga, weights, whatever it is that you enjoy, right? It's also then going to help with stress management. Moving our body, getting good flow, right, can help us. It can help with inflammation, can help with our hormone balance, and ensuring we are not over-exercising, right? Looking for a healthy weight balance is always going to help us in life and with our hormones, right? And so that includes, not over exercising or being underweight, which can impact our hormones, just as it can on the other side as well, too, working towards that healthy weight, that healthy amount of activity for all those different reasons that it's going to help us stress management, weight management, hormone balance, inflammation, and blood sugar balance in there too. Okay? Working on improving our sleep, right? Giving our body a good time to rest, restore. They're so essential for our hormone balance, okay? For actually being able to regulate our blood sugar and our blood sugar balance the next day too. And so simple things for this could be working on a wind down routine before bed, right? We ask our body to do so much for us every day, and then we say, okay, now sleep. And I'm like, why aren't you sleeping? Right? We need to create that separation between our day, right, and our sleep, our nervous system, letting it come down, right, stimulating that parasympathetic nervous system, that rest and digest, right, from that sympathetic fight or flight mode. So aiming for that 8 hours a night if you can, remembering, looking at our sleep window, right? We actually need a bigger sleep window because we're going to get even less hours of actual sleep than that. So not looking at our phone before bed, simple things like that can help to really improve the quality of our sleep. Finally, working on stress management, right? So if we are working on that wind down routine, right? Finding those little ways to relax, bring our mind, body, nervous system down every day, that can be huge, right? When we are talking about options to support stress, sleep, anxiety, when we're preparing for pregnancy, right? Inositol was an ingredient that we talked about to help to promote ovulation, but can also help with anxiety, particularly panic attacks, right? And then therefore stress and sleep as well too. Magnesium is a great choice to help us with this, and so is vitamin B5, which is also why we talked about looking for a prenatal with all of these great things in there. Ashwagandha can be something that can be help us to be supportive of our hormones, regulating those, can help with thyroid health, can help with stress. We can use this while preparing for pregnancy, but it's not recommended to be taken during pregnancy, okay? But all these different things we can look at, right, for lifestyle support with fertility, being able to help our body, our mind, our hormones, right, be in harmony to help to prepare us for pregnancy. And so when should we do this? it can't actually be too early, right? You could start to do this years before you want to try to get pregnant, right? The more things that we do that help with these things, right? When our hormones are in a really healthy balance, it helps our energy, it helps our mood, and it helps our fertility. When we're working to shift hormones, it can take 3+ months, okay, in order for us to even start to see changes. So really planning these things in advance, working towards them. It's never too early to start, but it's also not too late, okay, whenever you're trying. I hope that you found some of these tips helpful. If you have more questions, more things that you want to know more about in detail, let us know in the comments below.